It's good to have you back. We're still on our GBV focus this morning. An epidemic in the country. Intimate partner violence has been linked to mental health problems. The Lancet Psychiatry has published a comprehensive report looking at this particular issue. It was compiled by, of course, an international team of mental health experts, including Stellenbosch University's Professor Soraya Seedat, who joins me now to unpack it for us. Prof, thank you so much for your time and good morning to you. Let's talk about this interrelationship between intimate partner violence and mental health problems, particularly in this country. What have you found?
Intimate partner violence has a very complex relationship with mental health. It's a two-way relationship in that individuals who have experienced intimate partner violence are at much higher risk of developing mental health problems such as anxiety, depression, post-traumatic stress disorder, alcohol and substance use disorders, amongst other mental health problems. And so too are individuals who have mental illness at higher risk of being exposed to intimate partner violence as well as perpetrating violence. Now, most individuals with mental illness are not violent, but there is an increased risk. These are individuals who, by virtue of their mental illness, are more vulnerable, may be prone to being marginalized, stigmatized. And so it is really important that we consider the mental health consequences of intimate partner violence, given that IPV and mental health has for so long been marginalized, not just in South Africa, but around the globe. And we know that women and girls are disproportionately impacted by intimate partner violence. In fact, 1 in 4 women and adolescents over the age of 18 years will have experience of physical or sexual violence in their lifetime.
I want to talk about those consequences you've just alluded to right now. Prof, what are they?
So the consequences are far-reaching in that, in addition to the mental health sequelae of intimate partner violence, we know that women who are already economically disempowered could be even more impacted should they be in relationships where intimate partner violence is a dominant feature, where that violence is recurrent, where it is chronic. In addition, intimate partner violence, results in a host of physical health problems, and these physical health problems co-occur with the common mental health disorders that I've mentioned. In addition, we know that a woman at risk of losing employment or even getting into employment on account of violence within intimate partner relationships. So this is indeed a public health issue. It requires collective societal change in order to tackle it effectively. Yeah. And I think that's where we have fallen short, not just in South Africa, but globally.
And I want to get into more details about how you think we can tackle it. Obviously, collectively, different stakeholders would need to come on board here, Prof, to tackle this issue. But let's get to the nitty-gritties in terms of where do we start? Because we know that in South Africa, as you've mentioned before, we have different, societal sort of like women and girls are marginalized according to, economic, issues, perspectives, or where they live, their income, education level. There's so many factors contributing to this. But in your opinion, where do we then begin to address this problem?
Well, as I said, it does require collective and intersectoral approach, as you've alluded to. Our approach needs to be integrated. But we can start at school level. In fact, it is really important that schools tackle the issue of intimate partner violence, because intimate partner violence occurs across the lifespan. It's not a problem that is localized in teenagers and young adults. In fact, it occurs well into old age. We know that older individuals also experience intimate partner violence in their relationships. So at school level, it is important that we use the education within schools and the opportunity within schools to really raise awareness about the risk of intimate partner violence in dating and marital relationships, both in current relationships but also in previous relationships. And that we purposefully create an ethos within schools where we can model gender equality, where we model the importance of respect and reciprocity in relationships, at primary school level. Then, I think it's also important that health services are really attuned to the relationships between intimate partner violence and mental health. And I think that is where we as clinicians, both mental health practitioners, but general medical professionals at all levels of care fall short, because we don't ask about intimate partner violence. Most of us have not been exposed to training during our education and specialization, post-medical degree. And so we need to be trained to ask, to ask appropriately. We also need to be trained in, the mental health milieu to ask individuals who present with mental illness about whether they've been exposed to IPV, and then to act accordingly. And that really requires a trauma-informed approach to care.
Right. I have to let you go in a few seconds. Before I do, briefly, if you may, please, Prof, to what extent does stable housing and employment opportunities also provide, a solution to reducing, the stats that we're seeing in this country as far as GBV is concerned?
They play a really important role. So providing stable housing, increasing employment opportunities by reducing unemployment, and improving, educational opportunities across the board. These are critical issues, and by reducing intimate partner violence through those initiatives, we can in turn reduce the mental health as well as physical health consequences of IPV.
All right. Well, I appreciate you coming on to the South African Morning. Stellenbosch University Faculty of Medicine and Health Science Head, Professor Soraya Seedat, thank you so much for your contribution to this conversation this morning.